Hello everyone. I'm Dr. Himani Joshi, the Academic Director for DBMCI MDS and the original guru for oral and maxillofacial surgery. And today we are going to discuss the strategy for the upcoming INICET MDS exam May 2024. All right. So AIMS always gives the list of examinations well in the beginning of the year, and as they've already announced that the exam is going to be on 19th of May, which is a Sunday. All right. So gear up everybody. There are only 60 days to go for this big exam. So let's first discuss what are the most important subjects for INICET MDS. All right. So as we all know that dental clinical subjects are the most important. Now, which are these dental clinical subjects? See, questions will be there from every subject, but the number of questions will be more from some particular subjects in medical side and some particular subjects in dental side. Most importantly, we see a lot of image based questions, a lot of clinical scenario based questions from the dental clinical subjects. And these are the six most important dental clinical subjects for INICET: prosthodontics, conservative and endodontics, orthodontics, pedodontics, periodontics, oral and maxillofacial surgery. We are going to expect a lot of questions again this year from these questions: X-ray based questions, IOPA based questions, OPG based questions, CT scan based questions. Very, very important. Clinical correlation is the most important thing. All right. So gear yourselves, prepare yourselves in this format to give most importance to these dental clinical subjects. Other than these, there are six other subjects also from which we are expecting a lot of questions considering the trend in the past few years. All right. So other than the dental clinical subjects, these are the other most important subjects. Like always, anatomy is one of the most favorite of the examiners. We are expecting a lot of questions on head and neck anatomy, pharma, very, very importantly, pharma, surgery, and related anesthesia. Now, we all know that anesthesia is not taught to us as a separate subject. But since you read oral surgery, since you all read general surgery, you are expected to know certain basics of anesthesia, mainly the airway. The different types of airways are used in different surgeries: nasal intubation, oral intubation, fiber optic intubation, North Pole tube, South Pole tube, flexometallic tube, the different drugs that are used: propofol, ketamine, sevoflurane. So, all these drugs and the armamentarium, the equipments, especially the airway equipments, very, very important aspect. A lot of questions are usually coming from this topic and this subject, and we are expecting again that surgery related questions with either be the ATLS questions or the trauma related questions on ABCDE or the anesthesia related questions. Then PhD, very, very important subject for AIMS, for INICET. A lot of questions on planning, a lot of questions on the committees, a lot of questions on the the programs, the national oral health programs and the other national health programs. We are expecting this time also. PhD is a very, very important subject for INI. Please make sure you read it well. All right. Other than that, unexpectedly, in the last few years, we have been seeing a lot of questions from DADH also, from dental anatomy and dental histology. So please don't leave this subject. Please give some importance, some good importance to this subject also. It's a very factual subject. A lot of facts on eruptions, on cusps, on shape of teeth, on eruption timing, on histology of tooth, and the related structures. It's simple, it's easy, it's very, very scoring. So give some time to DADH. It's a good score maker subject. All right. And again, in the last two exams, in the 2023 May and November, we've seen a lot of questions from oral pathology images. Never ever they have been asked before, but the last two exams, the trend is that oral pathology image based questions are asked. They are giving you histopathology slides, histopathology images, and used to, they're giving you a question scenario, and you're supposed to answer the question by identifying the pathology on the image. So very importantly, those who've been ignoring oral path or just reading the theoretical aspects or the medicine aspects of it, please start giving importance to these slides. All right. So these are the other six very, very important subjects for INICET if you want to be a top scorer. All right. Now we all know that the paper pattern is going to be seven different kind of questions. All right, there are 7 types, and let's just quickly discuss what are they. First is the single best answer. All right, they will give you a sentence, they will ask you 4 options, and out of them, one will be the best answer. Now remember, students, you sometimes get confused, ma'am. A can also be the answer, B can also be the answer, or sometimes A, B, C all can be the answer. What should we mark in that place? Remember, it is always the best answer that needs to be chosen. Like, for example, if a drug is asked for, say, some helminthing infection in the liver, so you can give multiple anaerobic drugs, but what is the drug of choice? What is the best answer? That is supposed to be marked. All right, so for a TMJ ankylosis, gap arthroplasty is also correct. Interpositional arthroplasty with sternoclavicular graft is also correct. Custom TM joint is also correct. Stock TM joint is also correct. But what is the best answer? So custom TJR is always the best answer because that will give you the most accurate, replacement of the joint. So the best answer needs to be chosen. Don't make silly mistakes in these questions because these are straightforward factual questions most of the times. So look carefully at the question, look carefully at the options, then choose the best answer. All right. The next pattern is match the following. A lot of times you will be given 2 columns, 3 things on one side, 3 things on the other side, 3 or 4 or 5 things, and you will have to match the correct, disorder with the disease, or the correct syndrome with the symptom, or the correct, genetic mutation with the disease, something or the other like that. We have to really match the 2 columns. So match the following. It's a little tricky, but if you can match 2 or 3 things correctly, the rest usually fall in place. So please read the options carefully. Sometimes what the people make mistakes here is they will make they will solve the question correctly, but they will mark it wrong. So be very careful when marking these kind of questions. All right, so match the following is the next style. The third is multiple true false. So they will give you 2 3 4 sentences, and they will ask you which of these is true and which of these is false. So multiple true false. So here you cannot bluff, you cannot guess. You have to be very very accurate in every sentence. You have to know whether it is right or wrong. It's very difficult to bluff or to just guess in these kind of questions. Think carefully and take a calculated risk. Leave it if you don't know, take a calculated risk here. Next kind of questions are assertion and reasoning. Assertion and reasoning is that they will give you a sentence which will give you a statement, and then they will give you a reason for it. And then you have to match whether first place whether the sentence is correct or not. And if it is correct, whether the reason for that sentence which is given, that is correct or not. All right, so if they say that trauma is the most common cause of TMJ ankylosis, that is a statement, that is an assertion. And the reason is that evidence says that most of the cases that come to the hospital are coming after fall from bed or fall from height or something like that. So that's a correct reason why trauma is the most important cause of childhood TMJ ankylosis. All right, so um, like that you will have to, here they will really test your knowledge, they will really test your conceptual knowledge in multiple true false and assertion reasoning. So you have to be really thorough in your conceptual knowledge for answering these kind of questions. The number of questions which will be matched the following, multiple true false, assertion reasoning, they will be less. Most of the questions will be the single best answer type, but yes, these questions will decide your top rank, and you know that INICET seats are very very limited. So you have to be sure that your conceptual knowledge is good. Image based questions, a lot of questions have been coming, around 40 to 50% questions sometimes. At least 35 to 40% questions will be there which are image based, and you have to either guess the instrument, guess the pathology on the radiograph, guess the disease, guess the treatment. Different image based questions can be radiograph based, can be histopathology based, can be symptom based, can be treatment based, can be anything. Again, needs a very good conceptual knowledge, very good knowledge of whether you are able to interpret what is given in the image or not. So image based questions are the next style. Theme based questions, sometimes they will give you 2 questions on the same theme. So suppose they are discussing about fluorides, so they will give you 2 questions on the same theme. So these are theme based questions. Of late there have been not many theme based questions, but initially when this pattern was launched, every year they used to ask theme based questions. The last 2 3 years, these are less. Basically they are same simple questions, maybe single best answer type or image based type, but 2 questions on the same theme. All right, maybe they can be a continuation also. So maybe in the first question they are giving a scenario and they are asking a question. In the next question, it's on the same theme and it's a continuation of the first question also. Sometimes that also happens. So these are the theme based questions. Be prepared about them. Not necessarily that a question may come from this type, but be prepared. All right. And last is the clinical scenario based question. This is the very important questions. These are the tough questions. These are the questions which decide whether you are at AIMS or whether you're not at AIMS, whether you are an academic JR or whether you land up at non academic JRship. So, seats are limited. AIMS, PGI, this is the only two institutes of national importance where MDS seats are available, at least for now. Multiple AIMS, thankfully, now. So, there are seats around 32 to 35 seats are there. But those who don't get these 32 to 35 seats for the next, I think, up to 50 ranks, you are offered a non academic JRship, which is a kind of a JRship for 6 months. So, it's a very good exposure at AIMS, but it's not a PG seat. So, these clinical scenario based questions will decide, and these conceptual questions will decide where you will land up, whether you will land up at a PG seat or you will land up at a non acad JRship, which is very good, but it's not a PG seat. All right. So make sure that you're practicing each and every type of question very, very nicely for these exams. All right. Now, what should be your strategy? Now, we all know that there are only 60 days. I'm assuming that most of you will be starting your INICET preparations after the 18th March NEET exam. Those who are giving directly INICET, you can start your preparations from today. All right. But those who are giving NEET also, your strategy is different for NEET. You will be finishing your NEET on 18th March. Obviously, those who are preparing for a long time, you will need a break. But I will still give you a strategy starting from 19th March, because 19th May is your exam and you have exactly 2 months. So those who are really focused and those who are really eyeing the INICET exam, this strategy is for you. You can modify your strategy. All those who are giving NEET or all those who are starting from now, you can really add on to your days and you can modify your strategy. But broadly, you can just follow this strategy for INI. So basically, I have divided it into 40 plus 20 days. In the first 40 days, you will do a full all subject revision in slightly detailed manner. And in the last 20 days, you will do a quick brush up of all the subjects. All right, so the first 40 days, subject revision plus tests. In the last 20 days, quick brush up of all the subjects, of all your notes, of all the most important points, tables, charts that you have made, plus tests. Now remember, whatever theoretical knowledge you have, until and unless you practice giving tests, you are not ready for the exam. Test is the most important aspect for any exam. Give the test in the same pattern which is going to be asked in the exam, and that is the most foolproof strategy for becoming a topper. You take any topper, listen to their interviews. The most consistent thing that they have said is, we have been giving every test very sincerely, very religiously, and very, on time. Like a 9 to 12 exam, you should sit at 9 and take the test from 9 to 12. Don't sit at 1 a.m. in the night to give the test, because that your body clock will not be ready. You have to make your body clock ready for a 9 to 12 exam. So sit down at 9 a.m., take these tests 9 to 12. That is the best time to practice any test, and the giving test is the best format for any exam practice. All right, so this is the strategy. Just giving you a quick subject division, giving that not all these subjects have equal importance in INI. So NEET, we have every subject 14 questions, period. Medicine surgery 15 questions, every other subject 14 questions. But in INI, we have seen the trend. Like I've told you, there are 12 subjects which have a little more importance in the other subjects. So please give a little more time to these subjects. You all can take a screenshot, you all can take a photograph of this timetable which I have made. I have also put some extra days here with oral surgery, with medicine, with cons, with prosto, with oral path. You can shift these extra days to other subjects. If you feel your oral surgery is very, very strong, you can shift this extra day to anatomy. If you feel your medicine is strong, you can shift this extra day to pathology. If you feel your medicine is very weak and your cons is strong, you can give 2 extra days to medicine. So these extra days are for you. I mean, you can decide where you need that extra day depending on which subject is strong and which of your subjects is weak. All right. So you can divide, you can make your timetable according to you. Starting from 19th March up to 27th April, you will finish one complete revision of all the subjects. But it is not complete till the time you give at least two tests of full syllabus. You can keep giving small tests in between your subject tests, your whatever you want. You give tests. I will prefer you give at least 100 questions test every day. At least you give two full syllabus tests during the first 40 days. It will really help you, practice the pattern of the exam. It will really help you in the main exam. Coming to the next 20 days, the subject division should be, just 1 day per subject and one extra day for whatever subject you feel is weak. And towards the beginning of this division, also give two big full syllabus tests. And this is how I think by 16th or 17th May, you should be done with two revisions of all the subjects and at least four tests, which will really help you practice the exam pattern. Right? 18th May, what should you do 1 day before the exam? Now, INICT centers are sometimes away from your home. So, you should travel on 18th. Do not travel on the night of 18th to reach the examination center at 3 a.m. or the city at 3 a.m. That's a very bad decision. Travel on 18th. If your center is away, travel on the morning of 18th and take appropriate rest. Relax, take appropriate rest, eat well, sleep well. That will make you prepared for this very, very big exam. And whatever time is remaining on 18th, just pray to the Almighty God that, He gives you strength, He gives you the courage to answer properly, and He gives you the, stability of mind to remember everything that you have really read. All right. So 18th May, don't waste a lot of time on, traveling late night and eating all whatever you get. Give time to your body, give time to your mind, give time to yourself. Settle down on 18th for that big exam on 19th of May. All right. Now, like I said, what is the most important criteria for practicing the exam is test, test, and test. All right. So give as many tests as you can. Now, how can I help you? How can DBMCI help you? Is we've brought out a power plan for all of you, which is absolutely free of cost. We are going to give you 4 grand tests with solutions on eGurukul for 3 days. These tests are going to be live. You can give this test as per the schedule that you can all see. After the test, there will be a live discussion of the test with all the 19 subject faculties. You will be given an all India ranking for these tests with special focus on image based and numerical based questions. And you will also get a fully solved November and May 2023 paper absolutely free. All right. So I don't think there is anything better that I could think or we could think to give you. So please enroll for practicing all these tests. It is free for all DBMCI students as well as the non DBMCI students also. All right. So how do you give these tests? Just download the eGurukul app from your app stores. It is there for the Windows phone, for iPhone, for every kind of phone. This is the schedule of the test. There is a Power GT 1, 2, 3, 4 as per the schedule. It will be live for 3 days. These are beautifully created INI pattern tests with image based questions, numerical based questions. You have a paper of INICT 23 May and November paper where you can compare, what kind of questions were given before, had been coming before, and what kind of paper is coming now, is expected to come now. So you can very nicely compare with the previous papers. After these tests, it will be live for 3 days. So you have a 3 day window to appear for these tests if you want your All India ranking. All right, if you don't want an All India ranking, don't give this test on time. Don't give this test at all. For an All India ranking, give these tests within the live period of 3 days. All right, the very nicely created schedule is there in front of you. The test results, again, you will get it on your mails 3 days after the exam with an All India ranking. So you already know what is your level, where you are standing, and how much more you need to prepare. Or those who have really prepared well, you will get a real confidence that, okay, I am at a good position. All I need to do is continue with my studies. All right. So All India ranking and a complete solution of the paper on the eGurukul app. All right. After this, there will be a live discussion with individual 19 subject faculties on the live apps. You have to download one more app, which is the MDS Live app. And on that, You will have individual subject faculty, all the original gurus discussing their own subject. No mixture, no mix and match. Individual faculties will discuss their own subject very beautifully over the next 5 to 6 days. So you can live discuss every question with them. Any doubt that comes to you can be discussed then and there. All right. Parallel doubt solving can be done, and it's a very beautiful way to solve that paper. Other than that, you will always be invited to the daily morning mentorship sessions, 8:45 to 9 a.m. sharp, 15-minute sessions for a kickstart every morning, which is motivational session along with some question sessions, and you can discuss all your problems, all your anxieties in these sessions. Some senior faculties are usually there in these sessions. Mostly they are taken by me or some other senior faculties, original gurus from DBMCI. All right. So this is absolutely free for all of you. So please enroll on time so that you don't miss giving any tests. And in spite of giving this concoction to thousands of students, there are only 35 students who usually get selected in the exam. The difference between them and those who are not selected is just one difference. Everybody sees a dream. All right. Everybody has a dream. But that's not the end. You don't just have to see a dream, you have to work towards it. So, if you all know who Estee Lauder is, very, very famous American entrepreneur who has multiple brands in her name, very famous perfumes in her names. So, she always said that I never dreamt of success. I worked for it. And that's what we all need to do. You've already dreamt of being an Amazonian, of being a PGIite, of being a PG from one of the biggest institutes of the country like AIMS and PGI Chandigarh. You have dreamt of it. That is one aspect. Now, all you have to do is work really hard towards making your dream come true. I wish all the best to all of you. Practice your tests very nicely, study your subjects very nicely, and wherever you are stuck, we are there with you to help you. DBMCI hai, so no issues, no problems. Just work really hard towards getting and achieving your goals. All the best to all of you.